Hi everyone, welcome to another video of When Push Comes to Shove. Today we are talking about, believe it or not, holistic dentistry and how it can help your child's development, and we're going to talk about nutrition and everything in pregnancy. And I'm going to introduce to you today Marina. She is a former holistic dentist, and she's here to tell her story and hopefully to give you some insights when it comes to child development. So welcome, Marina. Thank you for coming.
Hi, Nikita. Lovely to be here, and nice to be able to have a chance to let people know about some interesting facts that they probably have no idea about.
Absolutely. So would you like to start by introducing yourself and telling your story?
You're frozen a little bit. There we go. Okay. No, we're all right now. Yeah, I qualified from the Royal London Hospital in 1986. So a very long time ago, because I'm very old. And I went straight into general dental practice as a national health dentist. And I then got married, had 2 children, carried on working in the NHS practice, then decided to open my own practice near Stansted Airport. So I opened my own practice in 1992 and went on to have another 2 children. After my 4th child, I was completely conventional. I used to think anybody that did homeopathy was a bit crackers, to be honest. My mum, who's German, used to say to me, "Oh, I'm reading in all these German magazines about how mercury in silver fillings is not good." And I'd say to her, "But that can't be right, because why would they teach us that at dental school?" Because you have this mindset, you go to dental school, you're supposed to be like, you know, the top students because you've got good grades and you get in, and you're taught by people that are very caring and loving. So why on earth would they teach you anything that was bad? So I wouldn't hear of it. Anyway, I was we didn't get any. I think we got 6 weeks maternity pay altogether on the NHS, well, as a dentist anyway. So I worked right up until all my first 2 children didn't get any maternity pay, but anyway, so I worked up until Rosie, my last one, was due, and she was 2 weeks late, and luckily I was able to have her at home. And when she was 3 weeks old, I used to have a nanny come in and help me during the day because I was obviously busy with dental practice, and she decided to have a week off work. And I had a very busy day collecting children from various places. My eldest daughter was at school in Cambridge, and I had one in Bishop Stortford at a school there, and another one in nursery in Stansted. So I got the baby, got everybody, went to pick up my eldest daughter from school in the evening. And on the way back on the M11, I had a car crash. I turned my Discovery over, and it turned 180 degrees, skidded facing the wrong way on the hard shoulder. On its side, and fortunately all the children were fine, but I saw a lot of blood everywhere, and I thought, what's going on here? And then I looked and saw the end of my index finger hanging off, my right index finger, which is, you know, the hand that I'm my dominant hand. And anyway, the long and the short of it is I got to Danenberg. The police were very good. They took my 3 older children to my mum's, and my youngest one, because I was breastfeeding, took her to the hospital with me at Danenberg, and was told that they were going to amputate my finger and part of my thumb, because apparently it also damaged my thumb. I ended up having lots and lots of surgery, nerve taken out my leg and put in my fingers, and they all said to me, "You'll never work again as a dentist because you're right-handed." And I thought, yes, I will. Unfortunately, I had to stop breastfeeding Rosie because of all the morphine and everything they'd given me. So she had to go on a bottle feeding. I wasn't able to change her nappy because of the risk of infection in my hand, because I had hours and hours of surgery, broken lots of bones. Anyway, you know, this all sounds terrible, and it was at the time, and I didn't know how I was going to get back to work, but I was determined I would. It took me 7 months, and I did get back to work. During that time, I went on some courses that I would never have done otherwise. One of them was a course about braces, and it was from a guy who came over from Texas. Now at college, I knew enough to pass my exams in braces, but I never really got it. So I used to send everyone out to an orthodontist, and then the orthodontist would say, take these teeth out, and I'd do my duty, take their teeth out, send them back, and the people would get braces. Thought that was fine because that's what happened to me. But I went and did this weekend course, and the guy I just sat there the whole time with my mouth open. He was saying, you don't need to take teeth out most of the time. You can make the jaw bigger to fit the teeth in. And there are so many health benefits that go along with that. And everything he said was logical and made so much sense to me. And I thought, if I get back to work, how can I ever extract children's teeth again just because an orthodontist says so, because they're better qualified than me? So I decided I'd learn more of his stuff. I did get back to work right-handed because I learned to write with my right hand, and holding a drill is very similar. There were a couple of little things I couldn't do, like pick things out of my pocket with my right hand, because I damaged the nerve to my middle and ring fingers. I had to have a nerve taken out of my leg put in there. So, but I practiced and practiced and practiced, and I was able to get back to work. But I also met some dentists on these courses who were talking about amalgam. And I was like, well, what's wrong with amalgam? And they said, we're not still using it. And I told them I was. And so they told me about the dangers of mercury. And I said, well, funny enough, my mum's been saying that. Anyway, I then found a dentist called, not a dentist, a doctor called Dr. Klinghardt, came from Germany. This was about 25 years ago. I started to attend his courses, and again, it was just jaw-dropping. He was talking about all the problems that mercury causes. It affects every single system in the body, in different people in different ways. You can become infertile because of mercury. Brain problems, nervous system, digestive system, it affects everything. And it wasn't just mercury, it was heavy metals. So that was the start of my journey. I did get back to work, realised I couldn't put amalgams in anymore because it would be against my principles. How could I do that to people if I then decided I couldn't do it to myself or my children? So I had to reassess everything and become private, because on the NHS I would have had to put amalgam fillings in, and I wasn't prepared to do that. So I then opened up a private practice. I then went on lots and lots more courses with chiropractors, cranial osteopaths, homeopathy, detoxing, all sorts of things. And I spent years doing that. And so I then developed a practice that was very holistic orientated. But I never told people you need to have your amalgams taken out, because I'd had mine taken out and it didn't actually make a lot of difference to my health. Not that I had bad health, but I had a very severe underactive thyroid gland. And, I think I was living a lot on adrenaline because I had 4 children, busy practice to run. I got divorced, and that led to lots of financial issues. And I ended up in 2015 losing my dental practice. And yeah, a lot of problems with the banks. And lost my dental practice, my home, and my career. And it was very difficult because I had nothing. But actually it was like a rebirth. But it took me several years to find out. And what I've discovered was, one of my friends said, try these detox drops. So I didn't want to, because I've been there, done that, got the t-shirt, got cupboards full of supplements, nothing ever worked for me. So I started to take these detox drops and went on some calls that the company were having. And I started to get really interested in detoxing again, because these things actually worked. I woke up for the first week every morning with stinky armpits, so I knew I was detoxing. I also was sleeping through the night, which I hadn't done for a long time. I carried on taking them, ended up losing weight. Then they brought out some other products, which I started to take. I had stopped taking my thyroxine about a year before I started the detox drops, only because I got fed up of taking it and I didn't want to take it. And then I heard that Kate Marina was sort of saying they've got aluminium in them, and I did my research, and yes, they did have. So I thought, how lucky is that I stopped taking it? But obviously, you get symptoms back. But I still managed to lose weight without being on the thyroxine. So I lost weight, and my brain fog started to go. I went on some of their other products, and then I realised I had a goiter. So they have a gel which you take orally, but I rubbed it on my goiter 4 nights in a row. My goiter disappeared. I decided to go and get my doctor to check my bloods. He phoned me up and said, "Oh, you're a bit anemic, but your thyroid's fine." And I said to him, "Well, you know, I haven't been taking my thyroxine for, I think it was about 2 years at that point." And he was absolutely shocked. And because I had been on 125 micrograms, and he said, well, he was an Indian locum doctor actually, so he was a bit receptive to the fact that I was doing something different. And he said, just carry on doing what you're doing. You don't need to have any more thyroxine. And so I was so interested in detox. I started to learn a lot more. My daughter was pregnant at the time, so I said to her, you know, I'm learning all this stuff, and they're saying that pregnant women should be detoxing because the environmental working group, and I can't remember what year it was, they did a study, and they found that newborn babies, when they took the umbilical cord blood, they found that there were, I think it was 285 or just under 300 forever chemicals in the umbilical cord blood. So the babies were getting the toxins from the mother. And so I said to her, you need to be taking these drops. And fortunately, she trusted me enough to take them. And she had a doula, gave birth at home. It'll be 2 years ago next month. And she has this very, very healthy, happy little boy who he's not had any jabs. He's as bright as a spark. He's really intelligent, you know, and I'm not saying that just because I'm his grandmother, but he really is a smart cookie. And I've heard from other people whose grandchildren have been born, we call them rooted babies, because all their mothers had given, when they were pregnant, been taking these drops, and they're all saying that their babies are really advanced and really, you know, great size. So I've got another daughter who's pregnant. She's in Guam at the moment, and she takes the detox drops. But you know, whatever detox you're doing, I do think that people should detox from heavy metals, because we are bombarded with them everywhere, and there's lots of different detox protocols around. You have to find what's best for you. I found what's best for me, and I found, you know, what's best for my children. But you get heavy metals in the air, you get it in your food, you get it in the water, even organic food, you know, it gets rained on. And then you have glyphosate in everything. Then there's mold spores, bacteria. So, you know, you need to be detoxing all the time. I think everyone needs to be detoxing every day. But you need to find what suits you, because there are lots of different ones around and we're all different. So I found what suited me. So I started to get interested in, you know, how all of that works. And what I'd also like to tell people is, you know, that even that breastfeeding, the breast milk contains lots of toxins. So it's just an ongoing thing, whether you use chlorella, cilantro, there's different detox regimes around. Just find something, do your research, do your own research. Don't listen to anybody. Do your own research, find what suits you, and then follow a detox protocol that is safe and effective. Don't use chemical things like EDTA because they are very harsh. Activated charcoal is not good to use long term because it takes out, they've done research to show it takes out minerals and vitamins. So my first thing is, if you're thinking of becoming pregnant, detox. If you're pregnant, find some detox stuff that you can take during pregnancy, and detox your baby, detox yourself, detox your partner. Then when the baby's born, breastfeeding. And it's not just about nutrition. Oh, the other thing I meant to say is, when you're pregnant, you need to make sure you have a diet full of really good fats, vitamins A, D, E, and K2. It's really important. You can get a lot of those from organ meats. I know people don't like to take those, but you can take some really good desiccated supplements. It's a bit more difficult if you're vegan or vegetarian, but you know, a lot of those vitamins you can get the sunshine. Go out in the sun as much as you can, take your shoes off, walk on the ground, ground yourself, because the EMFs are not great for you or the baby. And it's really a whole way of life. you know, don't sit in front of the telly too much, because they have EMFs that are given off that will affect you, affect your baby. Get out, get some sunshine, have good food, full fat milk, make sure you're getting all the fat soluble vitamins, because they're really important for the teeth and the bones and the jaw development. The baby teeth start to develop in utero from about 2 months. And then the adult teeth, the first adult tooth is the first permanent molar that starts to develop in the baby at birth. So you need to be making sure that your baby's teeth, because I am hearing about a lot of people having their baby's teeth are coming through brown or a little bit decayed, and then they're going to the dentist, and the dentists are telling the mums off for bottle feeding, and the mums are saying, no, I'm breastfeeding. And the dentists, you know, are not really being very helpful, because I don't think they understand that these teeth were developed while the mother was pregnant. You know, they were developing in utero, so the mother has to have good nutrition and detox to make sure that the mineralization process of the tooth germ development is going to go ahead properly. So that's it.
My daughter, when her 2 front teeth came through, the tops of them were discolored. They still are, but I must have been like lacking something during pregnancy, and it's maybe like hyperplasia, or I don't know, but it's I thought, oh god, are they rotten? And I thought, how can they be rotten? But I went to the dentist, and then, as you said, they're like, oh, it's bottle fed. And I said, I don't bottle feed. And the dentist said, well, breastfeeding is bad too, because it's full of sugars, and if she's sitting there to go to sleep with the boob, she's going to have that. I said, yeah, but they were like that when they came through. So I still am none the wiser from my dentist telling me why she's got these marks on her teeth.
Well, you can also get hyperplasia, which is, you know, where the enamel doesn't form properly, from if you're sick a lot during early pregnancy. When you're sick a lot, it's you know, I mean, I don't understand why this is what all we were taught at dental school, that you become dehydrated, and that affects the development of the enamel as well in the baby teeth.
Yeah.
So, you know, so it's nutrition, hydration. So yeah, that was, you know, I used to see it, and I used to reassure the parents and say, look, you know, it's nothing you've done. It's just, if you were sick, were you sick in pregnancy? And if they say yes, I'll say, well, that's it. And you can actually sometimes tell by the tooth development, about, if you know your dates of tooth development, which I've forgotten, but there are charts, you can have a look and see when the mum was ill or when she was suffering a lot, because depending on which teeth come through with the problem.
Wow.
So, and it's the same with adult teeth. You know, you can work out if a child was ill sometimes, if it's affected their tooth development, what year they were ill, by where which tooth has the problem. So,
and how does breastfeeding help with a structural?
Yeah, sorry. Yes, when you breastfeed your baby, the baby has to work quite hard to get the milk out, which is very good exercise for the jaws, and it also has to flatten the nipple and squeeze quite hard to get the milk out. Then there's 2 things that happen. First of all, it breathes through the nose, so you're teaching your child to breathe through its nose, which is vital, because when you mouth breathe, you're not let's say, when people breathe through their nose, you've got little hairs in your nose that catches a lot of the particles that are in the air, so that filters out a lot of stuff. When you get to the back of your nose, you get this gas release, nitric oxide, which is bactericidal, which kills the bacteria and it warms everything up as it's going through your nose to get into your lungs. Now, if you're mouth breathing, and it's cold air, you're getting cold air straight into your lungs, and you're getting particles fine particles that are in the air, because it's not being filtered out by the nose. And you're also you're getting the bacteria straight into your lungs, because you're not having that, it's missing that part out where through the back of the nose you get the nitric oxide, which is bactericidal. The other thing is that when you breathe through your nose, if you see children that have allergies and they can't breathe through their nose, they're like this, and they breathe with their mouth open, they walk around with their mouth open, and the tongue is a very strong muscle, so it'll encourage the lower jaw to develop beautifully. but it's not sitting up where it should do. It should sit up behind the two front teeth. The tip of the tongue should be behind the two front teeth, and when you swallow, you should swallow with your mouth together, and your teeth should just touch, and that allows your tongue to act a bit like a brace, and it guides the jaw to develop into a beautiful U-shaped arch. Now, if you haven't got your tongue up there, you're going to end up with a very narrow jaw and a very high palate, and the palate is the floor of your sinus. So if you've taken up a lot of the room with your sinus, you're not going to be able to breathe properly. You're more at risk of infection because you've only got tiny sinuses. You haven't got a nice big sinus because the roof of your mouth is impinging on it. So with breastfeeding, the action of breastfeeding, it allows the baby to swallow properly because of where it puts its tongue, and it also allows the nose breathing to occur. So you're getting a lot of benefit by breastfeeding your child. When you bottle feed, it's very easy for the milk to come out the teat, and so the baby's doing this all the time, which then acts as a brace as well because the muscles are quite strong, and they won't allow proper development of the arch. So that's why breastfeeding is not only good for nutritional reasons, but also for arch development and to encourage proper breathing. So if you've got a young child that is mouth breathing, obviously if they can't breathe through their nose, you need to get that dealt with. Any allergies, you need to sort that out. There are various practitioners you can go and see. I mean, anything I'm giving you is just for educational purposes only. It's not meant to be medical advice. It's meant to be a way of telling you what to look out for, do your own research, and go and find the practitioners to help you where necessary. So if you've got a child that's breathing through its mouth all the time, then encourage your child to sit at the table, chew with their mouth closed, and breathe through their nose. There's a orthodontist called Mike Mew. His father was very much into facial development. His father, Professor John Mew, and very hated by the orthodontists because he didn't like extractions, and he said you grow longer faces if you take teeth out, and you end up with so many other problems. And Mike Mew, his son, has taken on that fight now. And Mike Mew, there's lots of videos on YouTube where Mike Mew has talks about mouth taping. Put a bit of vertical tape across the mouth, and he says you can do that with your children when they're watching television, but you don't use any strong tape. Use something like micropore so that they know that they can, if they need to open their mouth, they can do. But he says, you do a deal with them. Like if you want to use your phone or your tablet for half an hour, you've got to have tape on while you're doing it. But you start off slowly, and you've got to build confidence. You can't just go and take their mouths up and let them get on with it. But he talks about that. He also talks about mewing, which is an exercise that you do to get the tongue and the swallow right, which helps with jaw development. So these are all sort of people you can look up. I know he's not taking patients on because he's so busy, but he's got some really useful YouTube videos. There's another dentist, an Australian called Steven Lin. He's got some really interesting videos about children, diet, and I think he's got a free fact sheet or something that you can, or a little book that you can download where he helps with children. But you need to make sure your children have a good diet as well. Less processed food, because processed food is not only does it lack nutrients and probably has quite a lot of toxins in, it's also usually quite mushy. You need to get your children to be chewing things. The harder the food they chew, and I mean things like meat and vegetables that are just al dente, they need to be chewing, because chewing also helps develop the jaws and strengthen the muscles. If you've got a very narrow jaw, or you've got a child with a narrow jaw, what might happen later on is they will end up with crooked teeth, and sometimes teeth growing out of the arch, and then you go to the dentist, and the dentist says, oh, can't do anything now until all the adult teeth are through, and then you need to go and see an orthodontist, and the orthodontist will say, yep, we'll take 4 teeth out and we'll put braces on. But the problem is every tooth is related to an acupuncture meridian, and usually the premolars are taken out, and they're the ones that are related to the spleen. Every acupuncture meridian is related to an emotion. So, you know, what are you doing to your child when you're having teeth taken out? Plus, a lot of children end up with beautiful straight teeth, but you look at their facial profile, they end up with a profile quite often where the chin's too far back, the lip is very flat. If you make the jaw bigger to fit the teeth in, there are dentists that will do that, but generally it's private because it's not available on the NHS. They will make the jaw bigger to fit the teeth in. You end up with a nice upper lip, particularly great for the girls because they get a nice big lip, you know, a nice upper lip because they're getting proper lip support. You get a nice bite, the jaw, the profile is beautiful. And not only is it looks, it's also about your bite affects your posture. So if you've got a poor bite, or children as well, sorry, I should have said this earlier. Children, if they have problems with their ears, that can be due to their bite. When I was learning a lot of this, I remember a little boy coming into my practice. I think he was about 2.5 or 3. He had recurrent ear infections, needed grommets, and I said to his dad, you know, I've been reading in a journal we had called Craniofacial Journal, which was alternative like orthodontics and chiropractors and cranio-osteopaths all working together. And they said if you build up the back baby teeth to the correct height, you can get better drainage of the eustachian tubes and your child might not need to have grommets. So I gave the dad the magazine to read. He came back and he said, yes, do it, because it was just really cleaning the teeth up, etching them so that, you know, making them so that the fillings stuck on, building the fillings up. Child never had another ear infection, didn't need grommets.
Oh, wow.
Um,
Why are
so,
children born with an open bite? Why does that happen? How does that develop?
well, an open bite develops, that is an abnormal tongue thrust. That is where the maxilla doesn't develop properly. A lot of children have tongue ties, so if you're worried about if your child doesn't latch on properly, there is a dentist in London, Malcolm Levinkind. Unfortunately, none of these are cheap because they're all private. But you know, do look these people up. Malcolm Levinkind, he's in London. He used to teach me at the London. Actually, he was a child specialist dentist, and a lot of children have tongue ties. So you can get that lasered and it's very quick and heals very quickly and allows them to breastfeed better and allows their jaws to develop better. I mean, there's so many things to it. Yeah. And so a lot of children who have ear infections, my friend's granddaughter, sorry, is 5 and she's got a bite like this where she's edge to edge because her top jaw hasn't developed properly. She was bottle fed and she can't hear properly. And I've said to her mum, she needs her upper jaw developing, and it can be done. I developed the last baby that was born who had to be bottle fed. She had a very narrow upper jaw. So when she bit together, instead of her teeth biting over like that, her jaw was so narrow, she had to twist her lower jaw to get them to fit together. And so we got all these photos of her with her jaw over to one side because she's biting. And so what I did was I put a tiny little, she was 2.5, I put a little brace in her and it was tiny to make her jaw bigger, and her jaw got bigger. So now her teeth are like that. But I could do that because I was a dentist and I, you know, was able to do that. But there are things you can do. There's myo brace. You just need to find the right dentist who can help you. Don't let them fob you off and say, wait till they're adults and we'll take teeth out. Because you are not adults, wait till they're adult teeth to come through.
This seems just as complicated as the maternity system. I mean, when it comes to the practitioners, you don't know what you don't know.
Yeah.
So how can you pass on this information as a dentist if you don't have that information? Equally, if you are a parent, knowing the right stuff to research, if you don't have all the information to hand, how do you know the correct things to research? How can you convince a dentist who hasn't been taught in that way to help you in a way that aligns with you? It's so tricky, and it's again navigating the system, doing your own research, finding things that can help you personally. I'm really of the opinion there is absolutely no black and white, like everyone, and people need to find the right supplements that suit them.
Yeah.
I'm sure most of you watching this know I'm very pro organ meat and things like that, but I also understand not everyone wants to take that. It's not about, you know, meat or carnivore or vegan. It's like intuitive health. I think that's the most
Yeah,
important thing, like listening to what your body wants and doing that rather than having a black and white approach to things.
absolutely. And I totally agree with that, because I also find some holistic dentists, they're running businesses, okay, but they're very, oh, you need to have all your amalgams taken out. Yeah, but if you take people's amalgams out, A, it's very expensive, and B, what happens if the nerve dies? If the nerve dies in a tooth that you've taken the amalgam out, then are you going to do a root treatment? They might not want a root treatment, because root treatments are not terribly good. Not saying, and then so if you have the tooth taken out, then you change the bite, because the bite affects your posture, it affects your airway, it affects your vagus nerve, it affects your cranial rhythm, it affects, it affects so many systems in your body, and most dentists don't realize that. And so, if you get someone they did an experiment in Italy, and if anybody wants to see it, I'm going to give Nikita's going to put my email address underneath, so please feel free. I can't give you any dental advice, I'm not allowed to, but I can send you papers and I can tell you where the right place to look, and I can tell you what I do. But other than that, I can't give you any dental advice. But they did an experiment with rats where they got some rats and they put them in special sort of boxes where they laid them out. I mean, they didn't kill them, but they anesthetized them, and they took x-rays of their spines. And then what they did was adjusted their bites on one side, so their bites were uneven. They let them run around for a few weeks, and 80% of them, I think it was more than 80% of them, developed a scoliosis. Then what they did was readjusted the bites and evened them up again. And most of them went back to having a straight spine, but some of them stayed with the scoliosis. So that's how.
I'm very interested in that. So I know someone who was diagnosed with scoliosis very late, actually. He's like 18, 19. And that makes perfect sense. From everything you've been teaching about, the breastfeeding versus bottle feeding. I'm looking back now to this young man's birth. Oh wow, it's so interesting. It all corresponds, doesn't it?
That's why I feel that people should know. But don't be wary of anyone that says take your amalgams out, take your root filled teeth out, because everything has a consequence. I had all my amalgams taken out. I didn't feel any better. The dentist that did it was very good. He's a friend of mine. He's a holistic dentist. He's a friend of mine. But now 20 years later, I've got to have a tooth extracted because the white filling leaked. I like the look of the white fillings better, yes, but was it necessary to take them out? I don't know now. Because I think maybe at the time it was, because we didn't have some of the detox supplements that we have now. The one that I take, you can take while you've got amalgams. And I would say to people, take something that you can take when you have amalgams that's going to remove the mercury out of your body and keep it out of your body, and then see how you feel. And then if you still want your amalgams taken out, do it. But don't do it when you're feeling ill, because there are people, I've been on a Facebook group where people have had their amalgams taken out with holistic dentists. They've had their root filled teeth extracted, and then when you have teeth taken out, you can get little infections in the bone called cavitations. Then they've had their cavitations surgerized. They've spent loads of money and they're still sick and can't get out of bed. Why would you do that to yourself? And I know the dentists are well-meaning, but it's like, do you need to fix absolutely everything? And my answer is, just take it a step at a time, heal your gut. That's the most important thing. Make sure that you've got the right mental status, because if you go to someone and say to them, well, you need to have all your amalgams taken out, any metal in your mouth taken out, all your crowns taken out, and root filled teeth taken out, what if they can't afford it? Are you giving them a life sentence, of feeling bad and thinking they're never going to get well because they can't afford it?
Yeah.
To me, that's wrong. That's as bad as the doctor saying, you've got cancer, you've got 3 months to live. You just creating, for many people, a self-fulfilling prophecy.
Yeah, I agree. I do have one question about fluoride. So
yeah.
A lot of mums and dads who'll be watching this will obviously be very aware of the issue with fluoride. Now, I've heard so many conflicting things. Obviously, fluoride's bad in the water, etc., etc. But when I went to take my daughter to the dentist because of her brown things on the top of her teeth, I said that I don't use fluoride in her toothpaste, and she said, "Oh, that's fine for now, but when she's 3, she's going to need some fluoride, and it's only a little bit." Now, from what I understand, it's it's obviously bad to swallow it. But what is your opinion on fluoride? I did go and see a mum about a year ago, and she had a newborn baby. She couldn't figure out what was wrong with the baby, and the hospital kept turning her away, saying there's nothing wrong with the baby. So I went to go and see if I could support her in any way I can. Turns out the baby had floric stenosis, and it wasn't diagnosed at the hospital. But that's a side story. While I was there, she was concerned about her son, and her son had very, very rot, like the teeth were rotting, they were very, very brown, and she said this has happened since I've stopped the fluoride in the toothpaste. But I assumed, okay, well, let's look at the gut health first. What is the child eating? But what is your opinion on fluoride in toothpaste?
Personally, I don't use a fluoride toothpaste. I don't recommend my children or my grandson use a fluoride toothpaste, because it's all very well swallowing it, but saying you shouldn't swallow it, but anything you put in your mouth, like anything you put in your skin, goes straight into your bloodstream. Does it not?
So how would you recommend to prevent the rotting if you're not using fluoride? Or would you say it's
Well, I think you need to detox, get the gut healthy. Orthosilic acid is very good. Silica, bioavailable silica, but it has to be bioavailable. There are, the detox drops I use have got orthosilic acid in, so you could use that to brush your teeth. My gums got incredibly healthy when I started using some of these products. Not that I had bad gum disease, because I'm a dentist, but I think it's over pushed. Brush your teeth after every meal. You don't use, again, the holistic dentists are divided. A lot of them say use xylitol toothpaste or xylitol chewing gum, because that removes all the plaque. But actually, there's another dentist called Danenberg, who unfortunately died last week. He was quite elderly anyway. He used to be a gum specialist, and I love his videos because he talks about the gut health, and he talks about how plaque is good. Everything has to be in balance. And so he says plaque on the teeth is good until it becomes bad. And what he means is that you have a balance of bacteria in your mouth, just like you have in your gut, good and bad. And if you destroy that balance, then that's when you start to get problems. And he says good plaque is there to have, it has 3 functions. It buffers the saliva so that it maintains a pH in the mouth, because you have to have a certain pH before you get, when the pH drops, that's when you get tooth decay. You need to have the good plaque there to, it produces hydrogen peroxide, which kills off some of the bad plaque. And it also acts as to help minerals get into the root of the teeth.
Oh, wow. I didn't know that.
Yeah, but you see, you go to nearly every dentist and they clean the plaque off, clean the plaque off, clean the plaque off. But you listen to Al Danenberg, and he gives you the papers, the research to show. And I love him, and I'm so sad that he died a couple of weeks ago. But I think, he was on a carnivore diet. He had multiple myeloma, and I think the only thing I would have suggested that he did was detox. And I don't think he ever detoxed the mercury, because when we're dentists, even if we don't put mercury in, we're always exposed to it, because you're taking it out of patients when they have a filling that's broken or needs changing because of decay. So, I think that was the one thing that maybe might have helped him. I don't know. I'm just guessing here. But he's done some great interviews where he talks about gum disease and plaque, and how it's not great to floss, because if you start flossing, you can introduce bacteria into the gums. And he talks about using little TP brushes. yeah, he's got a lot of really good information. But again, I'm happy to do like a little sheet for everyone to say, the dentist names that I recommend people look up on YouTube and learn, because it's fascinating stuff. I'm still learning.
Fantastic. Well, if you send me those dentist names, we can put them in the description of this video so people can learn more. So if people want to get in touch with you, and maybe you can talk about the detox drops you're taking, where can they find you? I'll put your email address in. Is that how you want them to get in contact?
Yeah, I'll give you my email address. If you put that at the bottom of the video, I'm happy to help. Like I said, I can't give any specific dental advice, but if you say, oh, I've got a child who's got this or that, I could tell you, what I would do for my child maybe, or where to look for help. But I can't actually diagnose or tell you what to do.
No,
Not allowed.
of course not. And there, like ever, we don't have any medical advice on this.
No, it's just all for education and entertainment purposes only.
Absolutely.
But at the end of the day, it's about letting you know that there are things out there that you need to be researching, because who knew half this stuff? I didn't know a lot of it.
Yeah, no, I know, and we learn more every day. It's fascinating. We can really go down this rabbit hole of every industry of health, like dentistry, maternity care, whatever it is. It's fascinating. Well, thank you so much
Absolutely.
for coming on.
Can I just say one thing? Don't get too hard. If you've got a mouthful of amalgams or root fillings, don't let anyone badger you into having them taken out, because you could set yourself up for more problems. Take it slowly, do your research, and detox for everyone. Find what suits you to detox, and detox every day, because we're all subjected to it. And for your children too. That way you'll help them achieve healthy teeth and jaws. And keep away from most toothpaste, because a lot of them have got a load of rubbish in them, SLSs and fluoride and sucralose. Some of them got just.
Well, if you put your favourite toothpaste, especially for children, I can put the links into the description so people can go and have a look for themselves.
Okay.
Well,
all
thank
right
you
then.
so much, Marina. Thank you for joining us today.
Okay, you're welcome. And yeah, everybody take care of your health and stay well and happy. Bye.